excited?
Absolutely.
I am so excited.
We are finally back. It's been a little while.
Yes. And today we're with some very, very special guests.
The incredible Dr. Craig.
And the sassy Dr. Lauren.
It's so nice to be here today.
Yes, they're incredible doctors. We look up to them all the time, consult with them all the time for all things body and also pleasure.
Yeah, pretty much when we want to get like our nerdy fix and then all things with sex, pregnancy, relationships, and cognitive craziness stuff. We just basically dive on in and pass voice memos, and it's a good time.
That's really sweet.
Yeah. So I thought we'd start first talking about having sex during pregnancy, because that is something we get asked a lot. Is it safe, and how do you do it well? And is it like, when would you stop doing it if you would, etc.
So overall, sex in pregnancy is extremely safe. The only time that we ever worry about sex during pregnancy is when there's something going on with the pregnancy. So if you are having any, vaginal bleeding, if you are having discharge, if you're having something that doesn't feel comfortable, stop and ask. Have your OBGYN check. But most of the time, you're going to get a gold star up until 20 weeks.
Oh, wow.
If the placenta is close to the opening of the cervix, at 20 weeks, sometimes some women will be put on pelvic rest. It's not really recommended as much anymore unless you're having discomfort or bleeding. But most women, it's amazing to have sex during pregnancy.
How would the average person know if their placenta was close to their cervix?
You can't know without an ultrasound.
Okay.
So at 20 weeks, most women get an anatomy scan, at least here in the United States, and it looks for where the placenta is inserted. So the concern always is if the placenta is too close to the cervix, that any time that we're having opening or pressure on the cervix, that we could have bleeding behind the placenta. And that's the only real contraindication to sex during pregnancy until the baby keeps growing and until that placenta moves away. And then with a repeat ultrasound, you'll get clearance to resume any sort of intrapelvic play.
So those are some of the things around clearance to be able to have sex, but are there any benefits though to having sex?
There's a ton of benefits to having sex during pregnancy. One, it feels amazing. The increased blood flow to the area gives you a lot more sensation, especially for women who haven't had a lot of sensation or a lot of sensation training. It is much easier to feel, and it gives you a lot of great feedback when the baby starts moving. Baby can sometimes get into sex just as much as the woman can, and you'll feel the baby move around. They're really interactive during that time, and they're really kind of happy jiving in there.
What about as a partner to a person who's pregnant? Do you notice any benefits for either yourself or the other person?
Yeah, so there's a lot of things that really are helpful. So some women find that it does help with the nausea and helps with pelvic discomfort. The overall texture of the vaginal canal itself changes. There tends to be a lot more lubrication, tends to be a lot more exudative, and you do get a lot more of a suction feeling because there's just the estrogen and all the other hormones cause an increased vascularity. And then there's also, as the pregnancy progresses, there's more and more pressure from the baby dropping down onto the vaginal canal.
This all translates into like good sensations and
right. And also there's also a gentle stretching and an opening of the pelvic floor, which tends to increase comfort as well.
Nice.
That's really interesting. So I think it would be really curious to find out in the stages of pregnancy, are there different qualities of pleasure and orgasm?
There are certainly different, right? So first trimester, early pregnancy, a lot of women end up with nausea. So one of the easy ways to get rid of nausea is actually with climax. An orgasm helps to release oxytocin, it helps with bonding, but it also has a benefit of side effect of really being anti-nausea. And it can help a lot of women to self-pleasure, to have pleasure with your partner during that time.
That is some great information.
During the second trimester, right, is usually known as the honeymoon period of pregnancy, because most of the nausea has gone away. you are comfortable, things haven't stretched as much as they will in the third trimester, and there's just a lot of increased vascularity. Also increased lubrication to the vagina. So it can be much more comfortable for women who were experiencing pain or discomfort pre-pregnancy to then experience that natural feeling, because the estrogen is so high, the tissues are all relaxed, and that is a great time to kind of experiment and play.
And by increased vascularity, you mean more blood flow?
More blood flow to the pelvis, more blood flow to the vagina, to the uterus, especially to the cervix. And the cervix for a lot of women is a place that they don't have a lot of sensation to start. And if you want to play around with cervical orgasm, really the second trimester is the place to do that in.
And it's not dangerous.
It's not dangerous,
You're not
right?
gonna
The only
bump
time.
the baby's head or bruise
Nope,
anything?
nope.
Okay.
For any pregnancy that is normal, that is not being, very closely monitored, your OB will tell you if that is something that you should be avoiding. If you haven't been told that it's something to avoid, it's not something to worry about.
So in general, if you're doing something that you shouldn't be doing, it's going to hurt. So really pay attention to comfort, and if it feels uncomfortable, listen.
And if it feels good,
Keep doing.
Keep doing. One thing that I've really noticed is that regular sexual activity, it really tends to help even out the mood and the drive and some of the other symptoms that are associated with pregnancy. And
can you tell us a little bit more about what are some of those things that it helps even out and smooth?
So a lot of it's connection and emotional regulation, and being able to help kind of be there and be steady for your partner. There's in the West, there's kind of this almost pedantic trope about pregnancy hormones and how women get dysregulated, and I think that's a lot of a misnomer, because there's more cycling of hormone pre-pregnancy, and there's more change in sexual interest and different types of stimulation on the hormonal cycle pre-pregnancy than there is during pregnancy, where you just have this sort of steady escalation of hormones until delivery.
Right, so if you look at a pre-pregnancy state, right, we get a cycling of estrogen and progesterone that happens. During pregnancy, our estrogen goes between 10 and 100 times higher than it ever has at any other point in our life.
Wow.
So if you think about the benefits of estrogen, we see, skin clearing for many women. We see that glow of pregnancy. But what it also does is it helps renew collagen in tissues. So if you've had issues in the pelvis before, what it's really doing is kind of juicing up and ramping up that pelvic tone. And then that continues to go through the second and then into the third trimesters. So the third trimester with sex and pregnancy is really where most women have the most difficult time, because you're going to have to try different positions that may not be your usual.
Exactly.
Right? Women cannot be directly on their back for a long period of time, because the baby weighs too much and presses down on the vein that's in our belly. And they can't really, more than 10 minutes, shuts off the blood flow too much down into the legs, and prevents that return. So women will get dizzy, they'll get lightheaded, even just from laying on their back. So what we have to do is we have to flip, right? So you have to roll. The left side is the preferred side during that time.
Why is that?
So that is because it takes the pressure off where the artery and vein are.
Okay.
So most people, it tends to sit slightly to the right of our spine. So if we roll to the left, then it takes that pressure away.
Great.
Such great knowledge.
When
Especially for guys that typically the average is 7 minutes long, so they're well within the 10-minute range.
So when we can roll the pelvis, right? Even in a semi-twisted or recumbent position, you can lay your shoulders back. But if we twist and roll the pelvis so baby is off of those veins, it can be more comfortable. Right? Doggy style, getting on knees, getting the baby to drop away gives a lot of freedom in the pelvis to then enjoy sex, because baby's head isn't pressing down into the pelvis.
Yes.
And being able to get in different positions that are comfortable for you, because most women start to experience low back pain or pelvic pain during pregnancy. And that really ramps up beyond 30 weeks. So really into that third trimester, any position that you can get comfortable in is going to help your experience with sex. It's also going to help your partner to have you be more comfortable, right? If you can find what you are already comfortable in, use pillows, prop yourself up, get in a spot that feels good for you, because you're already starting out in a pleasure point.
Mm-hmm.
Don't start out uncomfortable and then try to switch things around. So really kind of know the positions you need to be in.
So, and especially in the third trimester, you really want to be cognizant of, especially on the side-lying positions, actually propping up the baby, getting some sort of, baby wedge or wedge-shaped pillow so that the abdomen itself is supported. If there's a little bit of a size mismatch, so if you have a larger male with a smaller canal female and there's a lot of pressure, there's some different things that you can do. One is to have the woman control all of the penetration and all of the motion. The other,
this is third trimester.
This is third trimester. Second trimester, there isn't nearly as much pressure. Everything's really juicy and very elastic. But you can get kind of a full feeling in the pelvis, especially towards the end of the pregnancy, when baby starts to descend into the pelvis a little bit more. There are some different products that you can get if you're a little too long, to kind of act as a gasket or a flange or a stopper, so that you're still getting good sensation as the male, but you're not penetrating all the way into the canal if you do have a short canal or there's pressure issues.
You could always do just the tip.
Just the tip. Well, that's what it's that's what it's for. They make these little silicone rings that kind of stop.
Regulate the.
If you just want to try the concept, you can actually just get a nice handkerchief and wrap it around and kind of make a ring to flange.
To remind them.
Mm-hmm.
So those are two of the big considerations is comfort. So second trimester you're probably going to be more active. In the third trimester, a lot of the sex is probably going to be a little bit slower. It's going to be more about the intimacy. It's going to be a little bit more passive.
Some micro movements.
A lot of micro movements, and that's where amplifying pleasure with either external aids, focusing on clitoral stimulation, and actually using some of the things that Sayeda and Erin teach with the suction sex, and generating pleasure more with smaller movements as opposed to more sort of vigorous penetration.
I'm actually quite curious to hear, I mean, we've spoken then about the woman's cycle throughout this, but what about for men? I mean, do you notice that there's certain trimesters where you really want more or less, or does it kind of really fluctuate with the partner, female partner?
So, and maybe this is just how we're bonded, or maybe it's kind of in response to the female hormones changing. But I noticed that when my partner is pregnant, I'm a little bit more protective, a little bit more nurturing. I want a lot more of a emotionally nutritive quality to the intercourse, and that tends to peak and sort of progress as the pregnancy develops into the third trimester.
And interestingly, they've actually studied testosterone levels in partners who have a female pregnant partner, and they find that testosterone tends to drop towards the third trimester and is actually the lowest in the first 3 to 4 months after having baby. Now, whether that is because everyone is sleep deprived and we're not focusing on intercourse as much, but there's actually a natural cycle that happens in that first year where we get a drop that comes down at about 4 months and then slowly starts to rebound over the first year. And that may be in response to tissue damage that's happened in the female, that may be in response to low sleep, that may be in response to just having baby to nurture now. But there is a drop that happens for most men.
And you know, we don't really know if it's sleep related. We don't know if it's some exogenous cause. There is some speculation that it's actually to facilitate the transition into fatherhood, because if you are a, you know, male without child, the focus is external, right? You're bringing home resources back to the cave, you're fighting off the saber-toothed tiger, you're fending off other males, you're defending your territory, and then suddenly you have...
It's crazy here in Jersey.
It's crazy here in Jersey. Well, so suddenly you have a little life that you have to take care of, and you need completely and totally different wiring in your brain, both as a female, but also as a male. Yeah. And they've actually done some fMRI studies that anyone who is a primary caregiver for a child actually undergoes significant neuroplastic changes in the brain, and a lot of the areas of the brain that actually control socialization and empathy and response to nonverbal need and social cues and everything. And it's not just for the woman. It's a big makeover for the male brain as well.
Are we finally able to multitask?
No, I don't know about that.
Before we go into the membership part, where we're going to do a lot more, I want some explicit instruction from you in terms of positions and how certain things feel and work in the vagina as well, and how to prevent tearing for the birth, like all of that. I'd love to talk about that. But before we do that, is there anything we could say to the general public in terms of what's the best things to do during a pregnancy, just nutrition-wise, maybe just some basics that everyone could take care of to make the experience a little bit better?
So one of the things that I look at when I'm assessing someone's nutrition while they are pregnant is their protein intake. So women tend not to focus on protein nearly as much as men do. But what happens during pregnancy is that you go from needing around 1 gram per kilogram of body weight to 1.5 grams. Now, when we talk about breastfeeding, it goes up to almost 2 grams. It's 1.9 grams per kilogram of body weight. And what I see is that most women are not getting the protein requirements that they need, that they tend to be very heavily focused on carbohydrate during pregnancy, because that tends to be what people crave for a quick calorie when you're hungry, when your blood sugar's dropped, because we experience insulin resistance as women at baseline because of the placenta and the hormones that it secretes. So women tend to have cravings and go for the cravings. A lot of times they are not focusing on their protein intake. And what happens is that if we don't meet our protein intake, when we go through delivery, the repair process that needs to happen, we don't have the resources available in order to repair the body and get back to a pre-pregnancy state.
So that's super important.
It's super important. And if we're going to breastfeed on top of that, we've run through most of the resources that our body has growing the baby. And when we get to that stage, we experience things like low milk supply. We experience things like quick weight loss, because the body is utilizing all of its resources to feed our child now, and isn't focusing on us and ourselves. So, you know, I always say to my patients, you know, protein first, colorful veggies, eat the rainbow as much as you can, and then add on those carbohydrates on the side. They should be a side dish. They should be a finishing touch to your meal, and that shouldn't be the primary focus of what you're doing.
Fantastic. Thank you. Any additions?
I just as a partner of someone sort of going through this process, I would have to say there was a lot more food consumption during breastfeeding with our first child, and she actually lost weight very rapidly breastfeeding, and she was eating more than she was when she was pregnant.
Yeah, that makes sense.
I mean, pregnancy, the most you need a day extra is 200 to 300 calories. Right, so your body is able to process. You're sharing that blood supply with baby, and it's getting put right through. Your breasts turn on in breastfeeding, increase your metabolism at baseline, and then you have to make all the fats. You have to secrete the fats to send to baby through breast milk, and that actually takes you up somewhere between 700 and 900 calories per day extra you need. So there is something that we've nicknamed lactational hunger rage, because sometimes
Rage. It's like
rage,
road rage.
because at some points you will do anything for a snack, right? You'll be breastfeeding baby, and then all of a sudden it's like, Craig, get me a snack right now.
It's
like
real.
don't even.
It's real.
Like it's dangerous. Go grab me a protein bar, bring it here. It's dangerous if you are not fed in that stage.
Yeah, I love that so much. We should switch into the membership.
Yeah,
talk,
now that we're getting real.
Yeah, we can do that now. So, Craig, is there anything you want to add to this part before we?
If your woman is breastfeeding, always hide some ice cream. That's my advice.
All right. Well, with that, we will go ahead and switch on over.
Amazing.
To join us for the complete and explicit version of this podcast, just simply upgrade your membership and you'll get instant access.